Hello, good afternoon. We're here to welcome you to week 3 of Compliance 101, brought to you by Compliance Dashboard. And once again, our presenter is Olivia Ash. And please welcome her. And if you did not receive the package for today's, just shoot me a message in the chat and we'll get that over to you, but you should have that from this afternoon. So thank you very much. And Olivia, go ahead and take it away.
Thank you. So as we get some participants on here, we have a great showing so far, week 3. It's always one of those where you're like, oh, is it going to go? So welcome to Compliance 101, week 3. So I'm going to join some of your breakout, actually every one of your breakout groups today. That's a little bit different. And we're going to start kind of warm up with that, and everyone warming up again with getting to know one another and answering some questions before I get into content on the ACA. Now, another warning, similar to ERISA, this content today is going to be heavy with some formulas and a lot of legal language, for lack of a better word. And again, given the feedback that I received in week 1, many of you may find it just like drinking from a fire hose, and that's okay. And so again, I sent several documents a little bit later today. But there are several documents. I'm going to show you what those supporting documents are. And then we will have our breakout session, and I will join, get to know each one of you a little bit more, and have you sort of, as a group, warm up and answer a couple of questions, because what I want to do with this week 3 is start getting additional questions and hopefully kind of two-pronged. If you've been able to process the last couple of weeks, send questions in the chat and we'll use those going forward. But also, any particular questions about the ACA or any of the content under the ACA that we're going to talk about, or just in general questions that you've seen in the last week since we've talked. I want to start getting more feedback from each of you on what you're seeing in your particular areas with your particular firms. And given that we looked last week that this is a nationwide group, there could be some differences that I want to highlight as we get into the content next week. So next week will be cafeteria plans, if I'm not mistaken, and account-based plans, and then we're going to talk about HIPAA and the others. So I'm going to carve out some time to talk about specific questions. I'm going to have you send those to me today. So the agenda is attached, and we're going to look at the chat log review from last week. We had 3 particular questions, so I want to address those, and then I'm going to go over the review of the education materials. And then we're going to go breakout session and then just slide by slide on the presentation, the PowerPoint. So with that, let me go ahead and share the screen. And as always, send me your inquiries in the chat session. Feedback thus far. If you need more of something, less of something, it's quite important from my perspective to ensure that this content is appropriate and meeting your needs. All right. Excuse me, I have some sniffles. All is well, though. Okay. Let us have a look at the handouts for today. I think there's about 6 here. So we're talking about the Affordable Care Act. I will go through and we will just define that. What does it mean, etc. Now, the documents that I have attached here, as I mentioned, are incredibly lengthy and wordy. And I mentioned this before a little bit, but the CAA is kind of like ACA Part 2 happening just several years apart. So the first form is on Form 1094 and 1095 reporting. And this is about, okay, well, what kind of employer do I have? And is it a fully insured versus self-insured plan? Because as we have already learned, we figure out whether a plan is subject to ERISA, and then we go from, well, is it fully insured? Is it self-insured? Because different criteria apply under the regulations. And so this is a multi-page document here that talks about what kind of employer it is, and then what kind of relief is available. Now, this is older, but a lot of this hasn't changed. If there's specific questions, let me know. And I actually am going to go over the chat log review afterwards, because I think that this is important for you to see and then be able to comment on as we go through and process for our breakout group. Now, the second document here is information on the Department of Labor's safe harbor regarding electronic delivery rules. And there was a specific question about that I will answer and provide some guidance on here shortly. So again, general requirements of the safe harbor rules, whether it's email or attachment, posting documents to a company website. Of course, there's requirements, recipient requirements. All right, well, whether they have access, whether they don't. And what's really important to understand here is that when you are working with one of your groups, it's about that particular business's, how business is done. And that's kind of one of those questions that's always going to be asked if there's ever an audit. How is business conducted? And are you providing the document in the best way possible for those recipients? Because if everybody has access to the computer, then that would make sense to provide it electronically, and that could pass muster, even if the requirement says written. So have a look at this. The third document, we'll talk a little bit about this and what this means on employee counting methods. I'm going to get into a little law math is what I like to call it. So this document here will help outline some of the quite intense regulations regarding counting methods for whether it's a full-time employee or a full-time equivalent, etc. And so there is a question posed here on the left to determine X, Y, and Z. So in this particular case, let's just walk through one of these. So if you want to determine here whether the plan is subject to ERISA, well, it's when applied, health plans with one or more covered employees. On the first line I'm looking at, you count covered employees and former employees. And then you talk about how to count full-time, full-time equivalent, et cetera. And then there's additional guidelines. So this can be incredibly helpful as a reference for you or as a document to provide to your clients on counting methods if there's questions about it. And as you can see, this is a 4-page document with several different types of counting methods for mental health parity, COBRA, Medicare, etc. So if there's, again, have a look at this. There's questions, let us know. And yes, I'm giving you a lot of content as always, but that's there for your perusal because everyone learns differently. Now, this is a document created, I believe, last autumn, and we updated it specifically for open enrollment and COVID. So now when we talk about ACA and some of the requirements and some of the forms and documentation, we have a few of the things that will be in this checklist, but this will also apply to last week's content on ERISA and providing the appropriate documentation. As you can see here, this is something that could be helpful for you, but also for your clients. So there are basic steps, and I'm using this as a way to review from last week when it comes to ERISA. And remember, ERISA is the Employee Retirement Income Security Act, and it governs compliance regarding group health plans. And so in order for ERISA to apply, it has to be a group health plan. But then because of ERISA, we have documentation and notification are two major issues under ERISA. You have to be able to provide participants any information about their plan in a reasonable time frame and sometimes specific time frames, and especially if there are changes, particularly with reductions. So summary of material modifications and something is reduced. So open enrollment is a time frame when that can be done, and you all may have experience with this, or perhaps you don't. But open enrollment is actually not listed in the requirements as required, but they get around it and they say, if employer, you offer a group health plan, medical plan, for instance, you must notify participants, and open enrollment is when that is done. we see the basic steps for an employer or perhaps yourself to support them. We have detailed steps, giving an opportunity for groups to check off all of those notices that I rattled off last week. And if you took a closer look at the PDF of the content, you'll know that there are several notices required. Now, I also added a section because of the pandemic and COVID-19 and what kind of things might be out of the typical when you consider open enrollment period. And that is just taking a second look at some of the laws regarding disclosure of PHI under HIPAA, special enrollment extensions, COBRA extensions, mid-year elections, etc. So it's more or less a don't forget about these things that might have rules that have been extended on timeframes because of the pandemic. Okay, today we'll talk a little bit more about the requirement for the summary of benefits and coverage. So I provided you with a template, and this was the, if you'll see down here, 2021, 2022 template provided by the departments on, this is a huge requirement on a standard template to provide information to plans in an easily understandable way. Now I liken this, to when I teach, and the goal in education courses was to write everything so that an 8th grade reading level could understand it, because you never know who's consuming this content. And so it is in this format for a reason. Again, many of you may already be familiar with it, but given that this is a course on understanding basics of compliance, we want to ensure that you just take a look at it from a different perspective and just pause with it instead of going through the motions like often can happen. And then here, we just updated this document. Also helpful to have is the what to expect from an audit. Now, we haven't talked a lot about penalties as its own course, but every set of laws and fines and penalties. Last week, I talked about and provided you fines and penalties for ERISA and non-ERISA plans. Penalties apply, and it can be very complex, but generally, let's say you get notified that your employer is going to have an audit for some particular reason. This 5-page handout, and this is trying to simplify it, will provide you and your employer information on what to expect from a DOL audit. And it goes step by step on the first page. And then we straight up give you a checklist on what kind of documents could be required and some best practices so that it is basically kind of like, you know, cleaning up your house before you have guests come over type of situation. And if you look here, this document will go through everything that talks about whether it applies to the summary plan or your plan documents, trust plan. So this is actually, for this particular purpose of this course, it's actually a really good document to sort of check your own boxes on how you feel about the content. And if in this particular situation, if you think that I've missed something or you want to talk a little bit more about something, you can use this document as your own sort of like, hey, Liv, I really want to talk a little bit more about open enrollment policies or manuals. You know, what kind of best practices have you heard about? So just so that you can see what this looks like, I wanted to go through these. We'll talk about cafeteria and account-based plans next week. So it's a lot of information, and then we give you additional tips and et cetera for you and or your groups. So hopefully those documents will be helpful. All right. We've got it. Perfect. Okay, thank you. Good question. Again, remember, put in the chat feature what that is, and then I can carve out time in future weeks to address those situations. Because even though this content may be used going forward for another group of Compliance 101, the shared learning is essential, and that's why we're going to have breakout sessions and a couple of questions today on that. So continue to send that information. All right, so let's real quickly address there were 3 follow-up questions from last week in the chat log. And I won't go into detail because I will go into some detail, but not a ton of detail, just because they can be very complex. And I want to be sure that I'm not necessarily providing legal advice or getting too far into the weeds for this particular content. So the first question was the availability of documents on the dashboard. I was asked, well, is everything that I'm providing to you available on the dashboard? And I slept on that and realized that there were some content pieces that I provided that say compliance classroom. If you look on the dashboard and you go through and you can find it, those are all available historically from that particular webinar series, but not necessarily in a particular space. And I wanted to be sure to let you know that. So I'm working with our groups internally to get a more comprehensive library for you. Now, having said that, if there's a document that you want, you can always request it from us and we'll get that posted. So that's one of those where this has already created a better efficiency for us, because I think I did 22 compliance classroom webinars and had content for that over the course of 2 years. Some of those documents have been remodeled and put on the advisor portal, which is exactly where you will go to get any content. There's a link where you can actually go into a library so that you get all the content you can share that we've shared. But some of those compliance classroom materials are under a different web link where you can go and you can access every single one of the recordings. You can access all of the documents, but again, they're a couple of years old. So to the extent that they're all available, yes, they're out there, but we are going to make it a little easier for you to find those. And so I will work with our teams and we'll see if we can get some updates by the time this course is over. But always ask if you have a specific one, because I think I've created probably 60 documents in the last couple of years, and they're all slightly different. Second question. So what materials can we send to clients to help them understand their fiduciary duties? That question was asked last week. And I provided several documents last week on fiduciary duties, plus the video links. So this is really up to you on what you want to do, because there's two issues here. There are fiduciary duties that plan sponsors have because they sponsor the plan and they need to understand them. The content I sent you last week is going to help them understand what they're responsible for. Now, because people have different learning modalities, I sent you the video links versus the actual physical documents, like the tips on fiduciary duties. Now, the second prong is that, you know, there are certain fiduciary duties that you may have as brokers, and helping them understand what is and isn't your responsibility is going to be a combination of whatever your broker agreement says that you're doing for the plan, and whether that agreement says that you're doing something for the plan that is considered a fiduciary responsibility. So I can't fully answer that question because I don't know what your agreements are. So it's important to understand, let's say you have a block of clients and you've never looked at those agreements that you have with your firm. Most firms have agreements on what services they're providing to the plan. So having a look at those and understanding them a little bit more could help you be a better employee and provide more customer service opportunities, and also will help you understand what is their responsibility or what your firm is doing. Many times, brokers don't take on doing those fiduciary responsibilities like providing certain reports or making decisions about the plan type or plan benefits as an employer would. So I hope that that helps a little bit more. And if I haven't explained it as well for the individual who asked me that question, send me a follow-up question. You can send it to me privately through the chat and only I will get it, and then I'll get a report. And then before we go into our breakout session here, the last question is, what are the pluses and minuses of establishing a trust versus using general assets for self-funded plans? And again, from my perspective, that is really a loaded legal question, and it's not a cop-out necessarily. But the most, I would say, if we take a step back and look at it generally, so ERISA, of course, you have group health plans, and group health plans can be funded one of two ways generally. The employer is self-insured and they are paying all of their medical claims from their assets. Now, their own funds, right? Versus fully insured, where we have insurance and the employer is paying the insurance company to pay claims. And there's some math built in there for what we call risk corridors. Now, the money that is collected for the medical insurance, so let's say we have $100, okay, a month premium. Now, the employer can say, I'm going to pay 75% or $75 of that monthly premium. Employee, you have to pay $25 a month to have medical insurance that we are sponsoring for you. Then there is a requirement to have a trust set up, and you have to hold someone else's money in trust, because that is a plan, that's a fiduciary responsibility that has to be used solely for the purposes of the plan and paying claims. Now, an employer can choose to have general, no employee contributions, right? And so they can pay 100% of that, and then they can ask, and then they just pay everything from their general assets, and there's no trust requirement to be set up. That is a very elementary explanation of it. And again, just like the last question, if there's further clarification or I didn't answer it, or if there's confusion, please let me know and send me a private message, and I'm happy to address it. So these are the types of questions that are fabulous, and hopefully you're going to ask more here when we get you in your breakout groups next. So with that, I see we've got 30 participants, which is excellent attendance. I do believe that I had one more question that I want to address here, and I sort of already addressed it when I went over our documents. Can the last question from last week, can the summary plan description be distributed electronically? And the guidance is yes, but so employers can electronically distribute the SPD to employees with the ability to access the media where they perform their job duties. So in other words, if they use a computer with internet access and that is provided by the employer as an expectation to do their work, then you can provide it electronically. Now, if I were to come in as an attorney and say something and look at that, I would also say that you have to look at your workforce. If 100% of your workforce is using materials that are provided by the employer, and that's the only way to get information, then you can provide it electronically only. But I would caution against that and just say always good to provide it in a written format as well, because some employers have employees who don't have access for work to a computer, if that makes sense. Okay, so here's what we're going to do. Please send me additional questions. And I think I've answered everything from last week, and I don't see any additional chats popping up that are urgent or Q&A because I don't think we have the Q&A feature on. What we're going to do now is go to the breakout session, and I'm going to pop in to every group briefly. And what we're going to do here is, this is a question that I want you to talk about amongst yourselves and say, okay, look, we're going to talk about theory because, well, that's me, but also it's important to understand the drivers behind a lot of the law that we're going through, and it can be boring, but there are drivers from a legislative perspective. So what does quality, and you may need to write this down, or if you have already printed it in your breakout groups, what does quality, affordable healthcare for all Americans look like based on your experience? And so when I say your experience, I want you to think about your experience as an employee. So that is your own consuming of the plan and information, but also what you've seen in your roles advising and helping other individuals. So what does that look like? Now, when we come back from a breakout session, we're not going to have everybody talk and provide it like, a classroom. I'm going to pop into everybody and just chat about this. But what I do want you to do is send at least a couple questions, at least 2 if you can, via the chat regarding questions on the content since we've started, or that you have upcoming that have kind of popped up. So for the next sort of, I have 30 minutes allotted because I wanted to have about 5 minutes per group, and we have 6 groups. So basically, talk about this amongst yourselves. I'm going to pop in and then send me the questions, and then we'll take our bio break at 2:50 your time, 3:50 my time. So with that, hello, there you are. I'm trying to look at the screen but not look at myself. We'll just start from group, I think we got ACA first. I'm just going to go through the ACA Avengers, and we're going to go alphabetically. Hey everybody, so we're now recording, and welcome back from your break. These go fast because we get talking as a group, and there's a lot to cover. And that's exactly one of the reasons why we do breakout rooms, because there is an experience and knowledge to be learned from shared experiences from someone in California versus someone in New Hampshire. And so that's incredibly essential. So I am seeing everybody's coming back here. We have about 25 or 26 of you here who are joining. One caveat for this ACA content, much like ERISA, there's a lot on the screen, and that is much less than in my notes. So we're going to do everything we can, meaning I am, to get through this content. So again, I encourage you to absorb, have a look at this, send comments in the chat feature. I'm going to talk about the basics, and I'm not going to assume that everybody knows what the details are, though many of you from the conversations and the breakout sessions, I can tell, have some familiarity with this. Now, just a note on the breakout sessions, these are your final groups, and so for next week, I think we're all set. All right, with that, let's go ahead and get started on the presentation and just sort of the ACA and what it is. And as someone said, it's been around for a while, but there are persons here who are new, and for them, it's a little bit different. All right. So I'm going to minimize, and there we'll see me. Okay, very, very basic, but important. So technically, this is the Patient Protection and Affordable Care Act, okay? Its purposes, like anything else, I'm going to go over the reasons for this. Understanding the history is important, just like ERISA and the other laws we'll talk about. To expand public and private insurance coverage. The whole point here is affordability, right? Expansion of it. Increase the quality and affordability of health insurance. We talked a couple weeks ago, 157 million Americans have employer insurance. That's about half of the country. That number's changed a little bit, but that's a lot. So we need to make it affordable. To reform the insurance market and to reduce overall healthcare costs. Lofty goals. There's some disagreement or some opportunities for learning about whether that's actually happening or not. And that's the kind of chatter that I like to hear in the breakout rooms. Now, how does the ACA accomplish its goals? There are tools that are created. So like with any public structure and legislation, there are mechanisms. So we see getting accessibility and affordability through mandates, requirements, exchanges. I think of that as going to the supermarket. Okay, get some options here. What best works for you? Tax subsidies. So we're going to make sure that you can get some more money in your pocket if you do X, Y, or Z. New insurance standards. So we're going to police every state insurance companies are policed by the state. So the federal government's going to ask the state to police insurance companies to ensure they're being transparent and offering rates that are as affordable as possible. Asterisks. Guaranteed issue. And then we have Medicaid expansion and Medicare reform. So again, we're going to expand the ability for more persons who can't afford affordable health care to get it if they're in a particular situation. And for those who have worked their whole lives and they're eligible for Medicare, we're going to reform it so that it's a little bit easier and people can still get access to good quality care when they're not working until they can't work, or just, people don't want to necessarily they want to enjoy their lives when they hit that Medicare age. Of course, mandates quality, affordable health care for all Americans, okay? We have the individual mandate. So this is, you must have health insurance, minimum essential coverage, or pay a penalty. This is the individual shared responsibility payment. Now, there's a question here theoretically, and sort of like, what is minimum essential coverage? Well, that is health insurance that satisfies the Affordable Care Act. And that's, of course, a circular definition. But of course, most major medical coverage are going to be and are required to be ACA compliant. Now, this is typically calculated as a % of household income or dollars per adult and child under the age of 18. Each of you may know this a little bit better than I do by heart, but basically it's a complicated formula. I told you I talk about some of those, but essentially we have our individual responsibility payment. Where do individuals get insurance? Well, these are 3 avenues where individuals typically get insurance. Yeah, we have individual policies, group policies, and public insurance. And remember, nearly half of the country has some sort of employer-sponsored health plan. So this is big business. It's also big law. And the nature of both of those areas, law and business, can get complex. Individual policies, we know, are purchased through an agent or a broker, or on the exchange. And we have our metal exchange, which I call it, food market, kind of bronze, silver, gold. Group policies provided, of course, through an employer or trade union. And then we have public insurance. So this is where we get our Medicare, Medicaid, the CHIP program for children's health insurance, TRICARE, and the VA for veterans. There's always a balance between providing choice and then making it simple for someone. And that is a challenge in your roles. And you will know that well when you're trying to figure out what's going on and how you can kind of put things together. Now, the employer mandate says that ALEs, or applicable large employers, must offer affordable minimum value health insurance to their employees and dependents or pay a penalty. And we call this the employer shared responsibility payment, or the pay or play. So this is, it has to be affordable and provide minimum value to 95% of their full-time employees and children up to the age of 26, or be subject to penalties. This is where we get complications. I'm not going to go much further or deeper than that. We're talking about breadth here. If you use our dashboard, we have tasks and geek out pages to help you understand the quite complex formulaic situation. And this is why I included those handouts for today on how to count employees, because there's a lot there. Provide minimum value to 95% of full-time employees and their children up to age 26, or be subject to penalties. This happens, and the major issue here is if they get audited, and I can't spell clearly, AUDIT, or someone makes a complaint. We're talking about penalty for not offering coverage upwards of over $2,500 per full-time employee. So this is one of those where federal is using, the stick in that instance, because it could be very costly if someone were not to comply. Now, the affordability on the employer mandate in 2022, no more than 9.6%. And I think I said that was a different percentage. So not more than 9.6% of the employee's household income for the lowest price self-only coverage. Everyone, we have this year, we have this percent household income, lowest price self-only coverage. That's a lot of qualifiers. And so this is one of those that if you become familiar with doing this, and there are individuals who on this group who are, and there's individuals who told me that they are brand new to this, just know that there's a lot of factors to consider. Now, there are safe harbors to determine this affordability, where employers can go into a safe harbor and they, because it would be unreasonable for them to have to comply with certain situations, given their how much money they make and how big their company is and what they can afford to offer. That's why we have safe harbors. Because again, another delicate balance is we want to encourage capitalism in people, but we don't want to make it so that we cut employers' knees off, or you cut them off at the knees, so to speak. So there's 3 safe harbors: W-2, the rate of pay, and the federal poverty line. And here's what these look like on the surface. The W-2 safe harbor uses the employee's wages as reported in box 1 of the W-2. And there's a formula that you can see there to multiply the wages by that affordability percent and then divide by 12 to get a per month result. So these are the types of situation, perhaps you participate in them regularly, but if someone were to ask a question, where do I get these resources? These resources are on our dashboard, and also the content that we're giving here and how to calculate it. So in this one, if we were to use this example, if there's an employee who makes $50,000 a year, the coverage offered can't cost more than $4,805 annually, or about $400, right, a month. So keep in mind, this is the employee portion of the premium, not the employer portion. Employers can use the prior year income to determine affordability for the current year. So if there's significant salary changes, that's something just to be mindful of. I wanted to provide an example of that right now, but I won't go into detail for every single one of those. The second way that we have affordability here is the safe harbor is that rate of pay. So this uses the employee's hourly rate of pay for hourly employees or monthly salary for salaried employees. And again, these are just little bits of data points to have to recall and understand. So you can see the vast difference there from an hourly rate versus an annual salary on the per month result and whether something is or isn't affordable. And then the third safe harbor is the federal poverty line. This uses the federal poverty level in effect within 6 months before the first day of the plan year. And everybody, we've got a part right here within 6 months before first day of plan year. Just a note, if there are questions that are confusing, or a lot of times the criticism of interpreting this type of compliance and law, it's not simple. It can be very difficult and confusing and quite stressful. So I want to show you how, and not that you don't know this, but some of you may not, how complex, and these are all moving parts to consider. So if it can be overwhelming and it feels that way, I understand. And sometimes that's why compliance professionals or attorneys or someone will ask very specific questions, because all of these have very specific formulas. So the employer mandate minimum value means that we cover at least 60% of the total allowed cost of benefits provided by that plan. And this includes substantial coverage that's required of physician and hospital inpatient services. So how the coverage is considered, what kind of coverage is considered minimum value? We have to consider designation by the insurer, the minimum value calculator, and then an actuarial certification. Now, HHS has a minimum value calculator on its website if you wanted to check that out, if you're curious, where you can input the plan information and the coverages, and then it determines if it meets that threshold. And today I'm reading a lot because there's a lot of content, as I had mentioned. So if there's any additional questions, remember, put them in the chat feature. Who's an applicable large employer? 50 full-time and full-time equivalent employees. Okay, so full-time, and then you can see this here. We have our full-time average of 30 hours per week, or 130 hours during the calendar month. And it goes from there. And I'm going to have you reference that document I sent so that we have enough time to go through the basics. There's something here that's often forgotten that I see a lot in legislation when we're looking at this kind of information. Well, there's an exception for seasonal workers, but also sometimes individuals will forget that if there's a lot of sub-companies, LLCs, or different entities all own, common ownership basically, it's generally combined for this purpose. So when we think of common ownership, this is common ownership owned in the business structure from a legal perspective. Who's making those decisions? Who owns it? Who is responsible? When you're determining full-time status, there's two methods. There's the monthly measurement method, actual service, and then there's the look-back measurement. Looks at something as an average through a course of time. Again, all of this is addressed on the counting methods chart. There's the look-back measurement period. So we have a measurement period when you're looking back at this information. This is for ongoing employees. If you're looking at the 3 to 12 month long period, you're looking at an administrative period, which is no more than 90 days. So this allows time to total and average your hours, notify and enroll. And then stability, as the name suggests, is 6 to 12 months long based on that measurement period. So sometimes you'll get a question and you have to understand how someone is calculating those employees so they can determine minimum value and affordability, because it's all part of the ACA mandates to bring us back whole here. Look back measurement period. So this is just a chart. I'm not going to go through it. We just talked a little bit about it, but that is just a different way to have a look at what we're talking about and how to reference it, or perhaps this would be helpful for you to provide to someone that you work with. Let's move on here to exchanges. And we have exchanges. And what is an exchange? This is pretty self-explanatory. It's an online marketplace where individuals can go to compare plans, find pricing, and in some cases, purchase health insurance. Now, only plans that offer minimum coverage are on the exchange because it has to be minimum coverage. It kind of defeats the whole purpose. We have federal, state, and private exchanges. Open enrollment period, typically right now, it's extended to January 15th. It was extended, of course, we're in pandemic. We have our standard plans. I had forgotten platinum earlier, but there is platinum. But there are also catastrophic plans, and they're not exactly for everybody. They typically have a low premium, high deductible, used for major illness, et cetera, and you must be under the age of 30 to purchase that one. And I don't remember the specific, but I believe I recall that in one of the breakout sessions discussing that. Now at healthcare.gov, of course, this is a screenshot of what it looks like. Many of you are likely familiar. And these are all the things that can be done. If you haven't had a look-see at this, then it's kind of nice to go out there and explore it. I remember studying this in a health law course. And I remember being in a position during law school when life was changing where I had to go out there and consider whether this was a better option for my own insurance purposes and my own coverage needs. Then we have tax subsidies. We talked about different ways that the ACA implements to ensure that everyone is having affordable health care. It's also another way to ensure that everyone here on this call it has a full-time position, because there's so much to consider. So we have premium tax credits. And what are premium tax credits? Also called tax subsidies. They're aimed at helping low-income families afford health care insurance. And so when we look at this, it offsets those costs of buying insurance. And it is based, of course, on income level, paid on a sliding scale, and can be received in advance and paid directly to the insurer. Now, I wanted to see here, yes. So for instance, 2021 federal poverty level is $12,008 for individuals, $26,500 for a family of 4, just to give perspective. Many of you know what that's like. Again, these are the types of situations that a well-educated employer, when they're looking at, can decide on what kind of plans and what makes sense. It all goes into the same pot to sort of marinate about. All right, so we have some new insurance standards here. Generally, all policies are going to have to include these provisions. And there's, of course, like everything else, some exceptions for self-insured and grandfathered plans. And HHS has no enforcement method for retiree-only plans. Now, one of the most impactful here is the prohibiting of pre-existing conditions. We know this one on the exclusions. Now, essential health benefits, EHBs, okay? There are prohibitions on annual and lifetime limits, banning price discrimination, and disallowing pre-existing condition exclusions. I'm going to pause here for a moment. And remember, this is all already occurring. Many of you are familiar with it. It was kind of like the first step towards transparency and affordability. The CAA, of course, has now expanded and put even more, not necessarily pressure, though it feels like pressure, to have reporting, disclosures, and transparency on this information and ensure that consumers get it. Allows dependents to stay on the parent's plan until 26. And I actually helped somebody understand this the other day when they were talking to me about what kind of insurance they needed. And this was just out and about. And so a lot of times just the average consumer may not understand that, or maybe the employer hasn't educated as much, or maybe they don't know how to. And that's where you can help assist them, and we help assist you with those materials. Now, new insurance standards setting out the appeals process for determination and claims, okay? Requiring coverage of preventive services, and then prohibiting rescission absent the finding of fraud. So rescission is retroactive coverage cancellation, where they rescind and resize it, other than failing to pay premiums. The ACA prohibits rescission except in cases where there was fraud or what we call intentional misrepresentation, trying to get around the system. Our EHBs, ambulatory patient services, emergency services, hospitalization, maternity and newborn care, and then mental health, substance abuse disorder, or I like to use substance abuse or substance misuse. That's what I like to use when I teach my students, because substance misuse seems to be more applicable right now. Abuse, like anything else, has a different connotation. So when you're having those conversations, a lot of times I'm hearing mental health, substance misuse disorders, including behavioral health. So if it wants to be an ACA compliant plan, it's going to have to include these benefits. There are, of course, exceptions for grandfathered plans on certain situations. We have prescription drug requirements on essential health benefits, rehab services, lab services, chronic disease management, and then pediatric services. Many of you know this already. It's nice to have a list. It's nice to be able to have a resource to provide it to those employers. But also the whole point here is that if we're learning this at a 101 level, this is kind of ensuring that we're hitting all the major areas so that people can get the services they need for the situations that come up in life. Preventive services. There are different lists for adults, women, and children, and different requirements. So preventive services have to be covered, no copay coinsurance, and prior to the deductible being met. There are different regulatory situations here where recommendations, associations and groups make recommendations at a federal level, and this is what is the driver for changes in those preventive services and what is considered a preventive service. This recently came across on women's health and contraceptives. I drafted a blog on the updates on this one. That's on our dashboard. So that is what it's going to look like. And that's why it's important to subscribe and to stay on top of news and compliance. Again, these are going to be preventive services, things we think about here: wellness visits, some medication, avoiding certain behaviors. All right, guaranteed issue. So what is guaranteed issue? It basically prohibits insurers from denying coverage based on pre-existing conditions, policies that are offered to eligible participants, regardless of their health status. Keeps individuals out of high-risk pools, which are generally state-run, and costs are generally twice as much from a premium perspective to cover those who are high users of insurance. So we're trying to protect individuals, and you never know what reason people are using insurance. Maybe it's from a factor that is not controllable, or from a wellness perspective when I think about that. Now, like anything else, guys, non-discrimination is really important. So sections 1557 in the ACA is non-discrimination. And we will see this happen, and it flies under the radar, but it still happens. There is discrimination that is prohibited based on race, color, etc. It applies to programs administered by HHS or those that receive funding. If money is given, generally that particular situation is going to be applicable. There have to be notices of civil rights, Title VII of civil rights. There has to be a grievance procedure and a compliance coordinator. So those are important to understand, that there's always a process when it comes to this type of situation where anything is federally supported and it's getting funding. The Cadillac tax. All right, this is a provision of the ACA that imposes a 40% excise tax on high-cost employer-sponsored plans. Originally effective in 2018, pushed back this year via legislation, and then Trump signed a bill on 2019 that repealed it, but you may hear some more about it. And of course, because it was deeply unpopular, employers felt that it was unfair to punish them for being generous to their employees. But important to understand what it was. Now, the PCORI fee, the patient care, the research fee, this was extended. You can see what those fees are on the dashboard. So this is a provision that imposes a fee to fund the patient-centered outcome research fund. Applies to fully and self-insured plans based on the number of lives that are covered. And you can see that the $279 per covered life is applicable for this year. So fully insured plans are going to pay this fee real quickly here via the monthly premium payments to the carrier. Self-insured pays as part of the IRS filing 720. So 7 for self-insured is going to be that 720 form. All right. We're getting close, guys. Grandfather plans, these are some non-applicable changes, no pre-existing exclusions, the waiting period, the SBC uniform glossary, and the coverage. So again, this is only applicable to grandfathered plans. Always know what the status is. That's kind of one of those major gates of entry that I've talked about before. Preventive services, the employer benefits, claims appeal. Just kind of want to run through these. I provided to you the summary of benefits and coverage template. So guys, this is all about communication and making it simple. And I had mentioned that it's a chart summary, explains how the plan works in a easy to understand format so that we have consistency. Clear, plain language is a requirement, and it must be provided with enrollment or application materials upon renewal of coverage or within 90 days of special enrollment. And it has to have an internet address to review that uniform glossary of medical terms. I provided you a document on Form 1094 and 1095 series. I just updated some of our compliance dashboard tasks here. The 1094, think of it as the cover sheet for the respective 1095. This is transmittal information. They go to different places. The 94 goes to the IRS, the 95 is insurance and goes to the participants and the IRS. Forms 1095C and 1094C are issued by that ALE that offers that health insurance. This is to share data, again, back to the government, who gets what. You have this information so you can sort of check these boxes and answer questions as necessary. Then we have a Form 1094 and 1095B issued by the health insurers versus the employers. And it again talks about the information that's necessary regarding the plan. And then A is for the health insurance marketplace. Yay, we love a forms chart. There we go. Just want to make sure that you have that information. It helps to see it visually. Form W-2, okay, required to report the cost of coverage under the employer-sponsored group health plan in a box 12. So this is, again, having this as reference is going to be important here. Healthcare coverage is identified by the IRS as major medical, and the IRS has a great chart there on their website. If you need information on it, you can just go to irs.gov and type in some keywords if you need to find that. Now, of course, as we wrap up here at the bottom of the hour, we have the ACA. How is this enforced? Well, like many of the things we discuss, enforcement is done by what we call the departments, and IRS, DOL, and HHS. And you could have some state enforcements as well. You can see what they enforce, okay? And is important to understand that some of these things come from auditors randomly picking, but there are processes and procedures in place for you. Let's say it's your healthcare coverage and something doesn't feel right. There's a mechanism, and that's where we're going to get different auditing that happens, especially with the DOL, and someone is going to say, hey, this employee made a complaint. I think it's time to take a look at this. Hopefully none of this happens with your employers, but it's good to know. So we're at the bottom of the hour. I told you that there was a lot of content, but I hope that this has been helpful. So as a reminder, I am going to stop sharing here. Send me information in the chat box. We're at 4:30, and then next week we're going to talk about cafeteria and account-based plans. Again, another numbers heavy one, but I will have that content on a nice form for you so that you can have it for later reference.